Ready? Morning, guys. It's Dr. Emer in West Hollywood, cosmetic dermatologist, and we're doing one of my favorite treatments, and everyone thinks is really popular now, but 12 years ago I was doing this with two doctors in New York working on hair transplant. We were studying the use of growth factors, PRP, and stem cells for hair transplantation. Now we have young patients coming in who want to keep their hair, maintain its thickness, retain its vibrancy by injecting growth factors into the scalp. It's great if you could do it monthly, but in general, if you could do it at least every quarter, it's going to sort of preventatively help protect you from loss, but also thicken the hair and make it a better color and a luster. And if you see in here, there's a yellowish color. That's the PRP. This is the growth factors from her own blood that you know a lot of people have popularized using for texture, color, and tone of the skin. But here inside, you can see almost like a snow globe. There's little particles in there, and that's the pig's bladder stem cells. That's the Acell. This helps one of the most. So I always tell people you can put fertilizer on the lawn, but if you don't have the sun, this grass isn't going to grow. You got to combine both the properties of the stem cells plus the growth factors to get a good, nice growth. So a lot of women, especially younger ones that are busy, they are successful, they get a lot of stress in their lives, travel, etc. They lose a little bit of hair or it thins in this triangular area of the temple. We call it a triangular alopecia. And in general, to kind of thicken that area, we inject the stem cells to that area. And for women, more of the part width plus the temple frontal hairline. And so that's what we're going to focus on for her. She's doing really great actually in this central area. Now, a lot of people ask me, why aren't you numbing? Your patients are flinching. I say, look, it's very quick bee stings. The issue is, can you shake them more?
Yeah.
The issue is that when we did do this with numbing, when we put in nerve blocks, when we did topical creams, when we did cold air, it always made it worse. I don't know what it was. There was more swelling, there was more irritation. So I would just tell people we can deal with like 2 minutes of a couple little pokes here or there, and we just get it done and we move on, and there's no worry about swelling or irritation. We're focusing again on her temple triangular area. This needs a needle change. And remember, like this. Rotate like that, not up and down. And we're focusing on this temple triangular area where she has loss here, because this is where she notices it the most. And I really want her to get a lot of growth in the front part of her hair and in her hairline.
Is there any downtime?
Not really. I mean, you get some bleeding from these little pokes, but it goes away very quickly. And I always tell people, every so often you'll get like you'll get like a little bug bites that are there for a short time period, but within a few hours it's typically gone. How's the pain?
Oh, it's not bad at all. It just kind of feels like you're wearing a heavy hat for a day.
Yeah, that's true, because there's a lot of fluid that's added in there. And a lot of women notice more improvement in their part width, which is the center part of their scalp, faster than the outer portions. So for this time, we're doing a little bit more on her lateral portions than in her middle, because she's been doing really well in the middle. The other thing that's a little trick that we tell people to do is use a product called Restorcy. It's an actual spray. It helps the scalp itself for having little scales and also inflammation. But the second thing that we also have people do is use a little lattice on their hairline. And even though lattice grows hair in sort of eyelashes and eyebrows, it really does help with sort of thinning follicles. One, perfect. One more? Mm-hmm. Good. Thinning follicles of the frontal part of the hair, because I know is a little trick. So, in general, just wipe her there in a minute. Almost done, hon. She's doing great. So I'm just really trying to concentrate, like I said, you guys, for her in the frontal hairline and in that temple area.
How often can you do this procedure?
I mean, technically, you could really do this every couple weeks if you really wanted, but the stem cells really take about 4 to 6 weeks to kind of be kicking in. So in general, what I tell people is this. You do the first few treatments, 3 to 6 treatments if you can, every month. And then you can go down every 2 months for another 6 treatments, or every 3 months. And then I do myself every 3 to 4 months now, just to maintain. But there's ups and downs with hair, just there is with your life with stress. And in general, if you start to notice more hair shedding, do a few more treatments, and then kind of back off for maintenance every quarter. With the stem cell, I feel like we see much more quicker growth, less thinning of the hair, and also less falling of the hair, especially when women are in showers and they're either rubbing their hair and they're cleaning it, less of that fallout that we see. And then overall, we'll do that combination and just do everything we can to prevent it and keep that hair nice and thick and have a nice luster. Have a good day, guys. You did really good. I just wipe her here.